Hi Lauren, how are you
Hey.
feeling?
I'm feeling good. I'm kind of tired.
Okay. Well, we're 1 day post-op now. That's going to be pretty expected. It might be a little bit challenging to sleep over the next couple days. So if I can provide some ways to help that, because I'm sure you're sleeping on the couch, right? Yep. So, how's your pain level?
Like a 2. Like I just took one of my pills like an hour ago.
Okay, good. And they're working well for you? Okay, great. So moving forward, you're going to be in this lovely sling for about 2 weeks. I'm sure the doctors told you all this and the surgeon kind of followed up with you, but I just wanted to kind of be another point of contact for you. So the sling will probably come off in about 2 weeks. You can expect that it is going to be pretty sore for the next couple of days because they had to fix some of your ligaments as well as the fracture. So be expected to have some swelling and lots of stiffness over the next couple of days, which is where I will come in and kind of help break some of that up and hopefully get your pain down, and then maybe hopefully then work you to getting off of those pain meds.
Okay. What happens if like it still hurts after like I'm done with the pain meds?
Okay, great question. So what we're going to be doing is a lot of pain management. So we're going to be doing things that will stimulate like new blood flow to that area to signal more healing. So as I go through those, we will kind of walk through those together, and we will kind of go over what's best for you that day, depending on your pain level. But if we need to, we can try to see if the doctor will give you more. Chances of that happening are not very high just because pain meds can be very addictive. So we're going to try to do what we can without pain meds. If you need them, absolutely take them. That's why they gave them to you. But then after you've kind of finished your dose, then we'll find some more conservative ways to help manage some of that pain. And usually once the swelling gets out of there is when a lot of the pain will start to go away. And so we'll start doing some like light range of motion stuff. We'll be able to get some of that swelling out of the joint itself. Your hand will probably get swollen a little bit just from being in this position. Your shoulders is going to get a little stiff. So once we get out of the sling, that will probably be the most beneficial for you, just because your shoulder gets really stiff really quick. So once we can get out of that in about 2 weeks, then we can get everything moving, and hopefully you won't be in as much pain by that point.
Okay. When is my hand not gonna be numb anymore?
Okay, so that's very normal right now because they did a lot of stuff to you, and I assume that they probably had to do some neural things as well. So that should go away within the next couple days. We will also be doing stuff that can help with that, some like nerve stretching and flossing, stuff like that. So that will help kind of loosen up that nerve, but that should go away within the next couple of days. It will be normal for you probably sometimes throughout rehab to feel those numbness, tingling. Where do you feel that?
Like my whole hand.
The whole hand, not just like any specific fingers or anything? Okay. If it's the whole hand, that's probably just from surgery, and that probably will go away over the next couple of days, but definitely keep me in the loop about that, and we can kind of address it as we go, but I'm not too concerned about that at the moment.
Okay.
Are you concerned about anything else?
I don't think so. When can I go back? Like after I get out of this, like when can I go back to playing?
Playing lacrosse?
Yeah.
Great question. It just kind of depends on how your body reacts to the healing process and what kind of treatments we're doing and different modalities. So some people come back quicker than others. It solely just depends on your how quick your body heals. So kind of a little bit of a timeline for you just to get you in the right headspace. Sling will come off in about 2 weeks. Then we can start getting past 90 degrees. So they have you in 90 degrees right now. After the sling comes off, you'll be in a hinge brace that will be able to unlock. And so then you can go into more range of motion slowly. Like we're not just going to go right into full extension, but we can slowly work on that. We're going to be doing a lot of like wrist strengthening, shoulder range of motion, kind of getting the whole chain involved. But then after that, it kind of just depends on where your strength is at and how quick you get your range of motion back. We will probably want you to be at full range of motion 2 weeks after you get into the hinge brace. So within the next month, you should be for sure having full range of motion, hardly any pain, hardly any swelling. And then we can really focus on the strength aspect and getting all of your strength back that you had before, so that way you can be ready to play. But typically this injury is about 3 to 6 months as a whole, which will get you right in time for season, since we are still in preseason training. So I think that's a great goal to have. We'll set some little goals along the way for you that are more achievable in that moment, and so that'll just kind of be what we do from here on out.
Perfect.
Any other questions? Awesome. Well, I'm so glad that you're feeling better right now. We'll definitely stay in contact. We're not going to really do anything crazy today. We can throw some ice on it. For showers, this is another thing I wanted to tell you, because I'm sure you're going to want to shower soon. You can take the sling off, but I would wrap your arm in like a trash bag or saran wrap or something to cover your sutures. Your sutures are already covered right now with the ACE wrap, but having an extra layer of protections to make sure water doesn't get in there to prevent infection will be great. In a couple days, or probably tomorrow, we'll check your wounds, make sure they don't need to be cleaned or anything, just so, because you don't want to get an infection in that joint. So anything else for today? All right, well, I will see you tomorrow.
Thank you.